Hi, I'm Teepa Snow, and in the world of dementia, I'm considered a master educator. And what we're going to focus in on today, we've been talking about continence promotion, incontinence management, or what are some triggers for people living with dementia that set them off, that cause them to communicate their distress to us. And what we typically call that are create challenging situations or exhibit challenging behaviors. And what I would say is they're showing you they're distressed. So what around continence promotion or incontinence management might cause that? Well, it could be the words we use, how and where we address something. It could be their history with something. It may not be us at all. It could be something from their past that triggers something in their memory, and suddenly it could be the place, the space where we're doing something. Perhaps a small room or echo might cause trouble, or perhaps it's the number of people that are around or the kind of people that are around. So if it's not somebody I feel comfortable with, more than likely, I don't know about you, but I'm not really excited about revealing things, taking clothing off in front of somebody I don't know and don't trust and don't like, particularly if they're trying to take my clothing off and I don't understand why. So that gets into a trigger being my ability to appreciate that I have become incontinent, that I need assistance with continence. I may not know that because in the world of dementia, many people go through some part of being unaware. Now, it's not always the same. I could be aware sometimes and unaware other times. I could be unaware of certain things and aware of others. So I may have an awareness that I need to go to the bathroom, but I may not have an awareness that I need assistance to do that. I also may have varying skill levels. It could be that I have trouble using my hands, or maybe I have trouble sequencing. Maybe it's difficulty with appreciating the value of what somebody's doing. And additionally, it could be that you're noticing something I'm not noticing, be it visual or perhaps olfactory. You're smelling something I can't smell. And one of the things I'm not so tuned into as a problem is the odor of urine after it comes out, or the odor of a BM. So what that means is I'm not noticing what you're noticing. And so the trigger that you're getting, I'm not getting. So that means why would I change? I'm fine. I might not also pick up on a sensation like being wet, particularly if you're using a really good product. I think I'm fine. So one of the things we want to think about is, are there two different people involved here? And are those two different people experiencing the world differently? And if that's the case, the more I can imagine how you might be perceiving things, and the more I take into account you're noticing things differently than I'm noticing things, the better I can be a support, a help, and reduce those risks of distress and what we call challenging behaviors. So there are lots of opportunities to do things about this. Sometimes it's simply switching products. So a product that looks and feels more like this compared to a product that looks and feels more like this. The whole experience could be very different. So sometimes it's simply looking at what products we're using, but more often than not, however, what I'd say is it's not just about the product. It's also about us and how we approach the activity and where we might do the activity and what else is associated with that activity. But step one, take a look at what you're using and how you're using it, and be curious. Not judgmental, be curious. I wonder if that's figuring into this. Maybe we need something that looks more like something a woman has used before, if it's a female. Maybe like a sanitary napkin rather than a whole setup. And again, those can come in different absorbencies with this particular company. So just a thought, triggers happen all the time. The question is, who's being triggered? And I would say, both of us. What can we do? Become aware and choose to do something different.